Hello everyone. Today we will see about panic disorder. So in this I will talk about what is this panic disorder, how this panic attack occurs, what are the signs and symptoms, how to diagnose and treat this panic disorder. So let's start. First definition. This panic disorder is characterized by recurrent attack of severe anxiety which is not related to any particular circumstance. Means this panic disorder is a type of neurotic disorder. It is in this what will happen means recurrent attack of anxiety means patient will get anxiety again and again without any reason. In case of phobia, what will happen means patient they will get anxiety. So when they will get anxiety means anxiety fear means whenever they will come into contact with phobic stimulus. So at that time only we can see fear and anxiety in phobia. But in this panic disorder, without any reason, here everything it is normal, everything it is okay, patient but still patient they will get anxiety. Then after hours later he may become normal, and we can't predict that when this anxiety it will come and go like that. Next we see etiology. In this we see how this panic attack occurs. So here the main etiological factors are: first one, genetic factor, next biochemical factor, psychodynamic theory, behavior theory, and last one, cognitive theory. In this first one is genetic theory. So here in this genetic theory it explains through genes or hereditary how this disease condition we can see within our relatives. Here in this panic disorder it is most commonly seen among relatives of patient with this condition. According to this genetic theory, panic disorder commonly seen in monozygotic twins. So here monozygotic twins are formed when one zygote is created with one ovum and one spermatozoa, and later it split into two and form monozygotic twins. In simple word, if you want to say means twins those who have similar physical characteristics. So such twins are called as monozygotic twins. In such twins, any one twin got affected with this panic disorder means another twin also having 80% chances of getting this disorder. Next is first degree relatives. Here first degree relatives may be our parents, siblings, or our children to whom you have a blood relationship. If any one such first degree relatives got affected means there may be a 15 to 20% chances of getting this disorder. Next is biochemical factors. In this, alteration in GABA level will lead panic disorder. So here GABA is one of the neurotransmitter and which is responsible for our maintaining our mood. If any variation in GABA will lead mood disorder, and it may produce anxiety. Next is psychodynamic theory. According to this theory, failure to use repression will lead to panic disorder. So here repression is a type of defense mechanism. In this what will happen means in this repression we forget, by using this defense mechanism, repression defense mechanism, we forget any painful or simple situations which we experienced in the past. But in panic patient, they fail to use this repression defense mechanism. So this will lead patient to recall all sad, painful past experiences. So when they will recall all these unwanted sad experiences which happened in their past again and again, so this will lead patient to become anxious or worried. Next etiological factor is behavior theory. According to this theory, giving unconditional emotional response to painful stimulus will lead anxiety. Means whenever we got hurted by something or someone means we show emotional response for a particular period of time only. But in case of panic patient, whenever they will got hurted means they show emotional response for a long duration, maybe a day, 2 days, 3 days, or more than that. So this will make patient panic. Next is cognitive theory. According to this theory, any negative thoughts, negative thinking which may cause panic disorder. Next is clinical features. To remember these clinical features easily, we can use one mnemonic. What is that mnemonic means? Students fear the 3 C's. If we see each of these mnemonics, what it gives meaning means, first one by one we'll see. In that first one is students. In this, S for sweating, T for trembling, U for unsteadiness, D for derealization or depersonalization, E for excessive heart rate, N for nausea, T for tingling, and S for shortness of breath. Next is fear. In this, fear of dying or fear of losing control we see. And 3 C's. What are those means? Chest pain, chills and choking. This is about clinical features of panic disorder. When you ask regarding symptoms, if patient will complain regarding any four of these symptoms means, then easily we can recognize this disorder, panic disorder. Next is diagnostic evaluation. In this, first one is serum glucose measurement test to rule out hypoglycemia. Next, thyroid function test to rule out hypothyroidism. Why this serum glucose test and thyroid function test are doing means, in case of hypoglycemia or hypothyroidism, same clinical features we see how it is there in panic disorder. Next is ICD-10 criteria. So these are all the diagnostic evaluations which are useful to diagnose panic disorder. Next is treatment modalities for panic disorder. In that, first one is pharmacotherapy. In this panic disorder, anxiety is a main symptom. So to reduce anxiety, anti-anxiety drugs like benzodiazepine drugs are very effective. Suppose if patient is having depressive symptoms along with this panic symptom means antidepressive drugs are used. Next is beta blockers. So here beta blockers are used to control heartburn, palpitation and all. Other than this pharmacotherapy, behavior therapy, cognitive therapy, very effective to treat panic disorder. In behavior therapy, many type of relaxation techniques are used like deep breathing exercises, muscle relaxation techniques, guided imaginary techniques, listening calm cool music, which are all the some techniques which are used in behavior therapy to treat panic disorder. And in cognitive therapy, patient is trained to replace negative thoughts by thinking in positive ways. So thereby we can treat this panic disorder.